Hello my friends, welcome to the FRCEM Intermediate Mock 1 SAQ feedback. My name is Dr. Sujat Pathan and on behalf of CMED India, I would like to welcome you all. Firstly, I would like to thank you for trusting us and putting your valuable time in doing the mock exam. And I really apologize if there were some technical issues with the website. We are still trying to figure out how to stabilize it. So what I will do is we will be discussing the objectives first, and then we will look at the common patterns of mistakes. So that will be the plan for the day. There's a disclaimer slide which follows up, and then we would be solving the mock exam again with you guys writing the answers and checking the answers by yourself with the model answers provided. Okay, so the objectives of the session today is we're going to learn from the mistakes. We all did some errors and mistakes when we wrote the exam, so we will learn from those mistakes and we'll see to it that this does not happen again in our actual exam. Secondly, we can learn from other people's mistake, so that we are aware of such an error and we don't do it in the actual exam. So as I said, we are going to redo the exam again. So get your stuff with you, loads of blank sheets and many pencils as possible. Please do not write with pen, write with pencils. I will give you 30 seconds to read the question. What we are going to do is you're going to read the 3 stems of the question first and then go and read the main clinical scenario provided. Then you look at the picture and then try to frame the answers. You will have about 60 to 90 seconds to write down the answers, and then we will discuss the model answers. So let's talk about the common patterns of mistakes which people do. Firstly, I would say the most important mistake which people do is they do not get a copy of the curriculum when they start preparing for this exam. The College of Emergency Medicine has been very kind enough to tell us the specifics in the curriculum of what is expected. They have even given us sample questions and the model question pattern which are available and question allocations. So get a copy of it from the Royal College website, and that should be a very important thing. Secondly, understanding the glossary of terms. The glossary of terms are given by the college. At some exam centers, they do provide you with a glossary of terms in the exam, but to be honest, it is not useful if you want to look at the glossary of terms while you're writing the actual exam. You should read the glossary of terms before you go to the exam. By glossary of terms, I mean to say the college has specific terms like initial steps of management, definitive treatment, investigations, treatment. The best test or bedside tests, these are the terms which the college uses, and you should read the question properly what they are asking about. If they are asking bedside tests and you request a full blood count or a serum creatinine or a renal profile, that answer will be marked wrong because it's not done at the bedside. Although you will collect the blood and send it to the lab, it's done in the lab. So the bedside tests commonly are urinalysis, which is a urine dipstick, urine beta HCG, a blood gas. If the patient is in an arrest scenario, you would like to do a venous blood gas. In a pediatric patient, we commonly tend to do a capillary blood gas rather than a venous blood gas. An arterial blood gas is rarely done unless you are thinking about the oxygenation or ventilation status of the patient. Other tests which are done at the bedside are fingerstick glucose, ECG, a portable chest X-ray, a bedside ultrasound. The other mistake which we see is people writing incomplete answers. For a 1-mark question, usually the college prefers us to write at least 2 points. So if you're writing 1 point and the college is expecting 2 points, then they might deduct marks. However, the college nowadays prescribes you saying how many points are needed for getting the full marks. There is a slight change this time in the recent FRCEM final exam, where they have asked a 3-mark question directly. In the previous exam settings, they had asked one mark question. So 3 questions will be there in each question. But in the recent FRCEM final exam, they had put a complete 3-mark question, like give 6 indications of laparotomy in trauma. So you need to know all 6. This is a new change which has happened very recently. So don't get shocked if you see such questions in the exam. Do your best to remember the 6 things. If you can't, write down whatever comes to your mind and move ahead. Another common mistake which we see is people write what is given in the question stem. If in the question stem it is said that the patient has no risk factors for a DVT, that means they don't have any risk factors for a DVT. For example, like a recent surgery or a recent travel, lower limb edema, hemoptysis, or immobilization, or any history of cancer. If you write the same things again, you might not get the marks. Writing more than needed. Some people tend to write long statements. It has 2 negative things associated with. First thing, you waste a lot of time writing things and framing your sentences. Secondly, what you do is you may write something wrong, and that creates a bad impression about your preparedness towards the exam. So just write bullet points. Try to write as less as possible, but attempt all questions. And the big one is the next one, abbreviations. Many students, in fact almost all of them who have done the mock exam, have used abbreviations time to time. Abbreviations like NG tube, RTA, NPO, they are not acceptable. Even though if they are acceptable, why to take the risk? Write the full complete word. Writing general answers will not fetch you marks. Fluids is not an answer. You need to write IV fluids, colon, 0.9% normal saline, 20 ml per kg. That's the right answer. Analgesia. Everybody knows if somebody has a fracture or pain, analgesia is the treatment. Even a layman knows about it. So writing analgesia will not fetch you marks. You need to write IV or per oral paracetamol 1 gram based on the weight of the patient. It's just like writing somebody's having a serious infection or septicemia and you write antibiotics, which will not give you marks. You need to be very particular about it. You can say antibiotics, a colon, and then say IV piperacillin tazobactam 4.5 grams stat. Then the tendency to ignore the basics. The basic things are like, if you see a patient who's in pain, the basic thing is you'll give analgesia. However, some students jump to the definitive treatment and write the definitive treatment instead of what will you do next? I would like to reduce the shoulder. Well, reduction of the shoulder is going to happen, but what will you do before that? You would be doing an X-ray, and before sending him for the X-ray, you would like to give patient some pain medicines. So per oral paracetamol plus codeine 60 milligrams, arm's length, request an X-ray, or moving the patient from one place to the resus room. These things tend to be forgotten. Another common mistake which I have noticed is using brand name of drugs. I have come across people writing F-Corlin, which is hydrocortisone. I know F-Corlin is hydrocortisone because I had worked in India, but in the UK we don't know what is F-Corlin, what is Evil, and there is nothing such as soda bicarb. It is sodium bicarbonate. So don't use brand names of drug. Don't write Zocin. Although Zocin is a very common term, don't write Emicet. Write ondansetron. Write piperacillin tazobactam. Last bit is interpretation of images. When the question says what are the abnormalities seen in this question, in this picture, you need to write what you see rather than writing a definitive diagnosis. You can follow up your explanation of abnormalities with the diagnosis, but you need to write what you see. For example, an atrial fibrillation with fast ventricular rate. If you write atrial fibrillation with fast ventricular rate, you know you are writing the diagnosis. But how about writing as absence of P waves, narrow QRS, irregular rhythm, tachycardia, left axis deviation. So go with the pattern what we learned in the ALS. Rate, rhythm, axis. Any of it is abnormal, just write it down. Then P waves, PR segment, QRS complex, ST segment, T waves, or any other abnormal waves. You can mention them in that order. If you still want to write down the definitive diagnosis, you're welcome to write it, provided you know that that is the right diagnosis. For another example is when asked about interpret an X-ray or what are the abnormalities on an X-ray. For example, take tension pneumothorax. I would go with A, B, C, D approach. Airway, so the trachea, whether it's midline or not. Breathing, which is the lung markings, whether they extend up to the margins of the thoracic cage, and whether the lung is collapsed or not. C is the cardiac shadow, which is mediastinum, whether it is midline or whether it is enlarged mediastinal window. D is the diaphragm, whether both the domes of diaphragm are clearly seen, not elevated, and are clear. And E is everything else, which is the bones and the skin and soft tissue. So if you go by this pattern, you'll be able to write the answer what abnormalities you see. From an X-ray, you can't definitely tell. You can say it's a large intestine versus a small intestine based on the differentiating features, but you can't say whether this is cecum, whether this is a transverse colon. So there was a question which showed a coffee bean of sigmoid volvulus, and many people just wrote coffee bean side, or some people wrote sigmoid volvulus. And writing sigmoid volvulus will not fetch you marks, although that's the right answer. But what are the abnormalities seen? I see a dilated loop of bowel or dilated loop of large bowel appearing in a coffee bean shape, likely sigmoid volvulus. This would be an ideal answer rather than writing cecal volvulus or writing sigmoid volvulus. So I hope you learned from the common patterns of mistake, and when you do the mock again while you're writing down today, you will not do these mistakes again. Before we proceed further, I would discuss some disclaimer which was presented even while you're doing the exam. This mock exam covered high-yield curriculum topics and questions as per the FRCEM guidelines. CMED India mock exam is not affiliated to the Royal College of Emergency Medicine. This was a difficult exam, not to trouble you, but to encourage you to think beyond the common scope of intermediate exam. And this was a computerized exam, so I can't really comment on how your handwriting is and whether it is legible and easy to read and within the box. Please do not reproduce this video in print, electronic format. Please don't share it on social media. And the images which are given in this mock exam are taken from Creative Commons. We don't own these images, and if somebody owns this image, they can tell us and we would be happy to replace it. Well, get ready with your pencils and papers, and we will proceed in the next video. Good luck with the mock again. Thank you.